So, a diagnostic of a 46-year-old who has just had one episode of chest pain and shortness of breath, went to an outside hospital, got his angio done, and this is the angio. This is now which was repeated here, and this angio showed a occluded LAD and a tight narrowing in the OM here, and then he underwent a thallium scan which showed large area of ischemia in the anterior wall. So obviously he's got a left dominant system, the right is non-dominant and filling the LAD from the right side, as we will see later. So this is his angioplasty. So I just took some diagnostic shot, and you can see that the LAD, this area is totally blank, and this is a long OM diffusely diseased with a tight critical narrowing here. So the first thing was to balloon this, and unfortunately after the balloon we were planning to do a DCB, but there was a lot of disruption, and I thought this hematoma here or in dissection would probably not keep this vessel open for a long time. So we put a stent in, and then after the stent just massage the vessel a little bit, also put a wire in the other one, and balloon this, and then the end result was acceptable. There was some narrowing on this area, but it's an acceptable result. So this was the OM PCI, but the main aim is to revascularize the LAD. This is our LAD attempt. Went in with a Gaia 1 which crossed easily, but then in the mid area I could not see where it was going. So then we punctured the left side, and as you can see that there is this LED, and this is a bend here, a 90-degree bend, and this is the diagonal, and you can see that this was filling through a conus branch. So this is filling through this non-dominant vessel, and you can see the whole LED filling through this RV branch here. There's this RV branch here, and this fills the whole of LED, which is kind of diffusely diseased. In the middle goes up, and my wire is in the mid part of this junction where there's a 90-degree turn here. 90-degree turn here. So now the plan was to try and wire this, but the wire would not go. It was, you can see that the wire is, this was a fielder, it was not going, whisper was not going, this was too much of a turn. So eventually I used a Gaia to put it into the diagonal, and then planned to balloon this area to see if we can get some angulation change. But so now it's filling antigradally, but the angle has not changed. There's a lot of calcium in this area, and this area is not, you see, this is the 90-degree turn, there's a lot of calcium, and this LED is all the way, and the diagonal is going all the way. Not a very big diagonal diffuse, but now the LED is filling from the anterior antigrade part. So I used a 1.5 and then used a 2mm balloon to try and open this, but it wouldn't work. So the next step is to use a Twinpass. So this is a Twinpass, and using a Twinpass, we put a second marker, the proximal marker, at the junction, and managed to get workhorse wire through this area. As you can see, we managed to get this wire down here through this Twinpass, catheter. It's got two markers. One marker is here, one marker is there, and we managed to get a wire in. And so this was the hard part. And then you can see that this is a calcium nodule. It doesn't open up very easily, so a lot of ballooning, and still there's a so managed to get a balloon down and started ballooning all the way up. So now you can see that the LED is fairly disruptive. I haven't done anything here, but this is underfilled. The LED is filling all the way up here. So now the next part is to see how we can get this stent down. We couldn't get the stent down despite everything. The stent wouldn't go in despite this. A long stent wouldn't go in. So this is a short Orziro which we managed to put it in, and use this, inflated this Orziro at the junction to straighten the junction. So now we've got a stent across that bend area, and there is a disruption here. So now we've got another stent which was originally planned for this area, and we managed to get this through into that distal part and inflated that, and measured it. So now the LED is coming out, but if you can see, there's a lot of disruption and narrowing here. The LED has though opened up. Now that the LED has opened up, we are going to now use another stent. Rather than stent distally, I'm going to place this stent proximally, and so this is probably going to end up as a full metal jacket now. So a lot of ballooning and NC balloon all the way down, and then we inchworm our way into this stents using the balloon to inchworm ourselves the guider, the diagnostic, the guide extension all the way into stent without causing the longitudinal disruption or distortion. So we've got this guide extension here. We got the guide extension all the way up here, and now we've managed to put in another stent and did this, and now this LED is opening up, but I am still not happy with the distal, this part, and I think in order to, now that we were committing to stenting, so I'm going to put in another stent here and use a 2mm balloon, and a lot of this is the stent that I now put in a 2.25 here distally after initial dilatation. And now I'm going to do a lot of NC ballooning, and distal also I'm going to try and see. So now there is this apical part, there is still a tight narrowing there. Now that you've committed, so I'm going to use 1.5 to open this up, and this opens up at last. So now the results pretty good. So now you can see that the result is pretty good. The LED is totally made, all the septals are fine, the diagonals are coming off, this diagonal is also preserved, and the apex is fine with little bit of disruption. So this is a good LED result, acceptable, full metal jacket, looks pretty good all the way. You got apex, the whole of apex. This is a not a right dominant system, so clearly this is the part of the inferior wall is being supplied. This is a wraparound LED, and it is perfectly looks quite okay. So when we thought we'd done it, but then we noticed something else. We had finished off the procedure when we noticed that there is this tight narrowing here. So this obviously cannot be left alone, mainly because the pressures had also dropped. So this probably, so we'd taken out the guider, we looked at it, put the guider back in again, and looked at this discrete lesion. This is a carina shift because of the stent that is at the LED. So this is a narrowing here. So the stent at the LED has probably pushed this across. So clearly we put in another stent here and used kissing balloon and post dilated it. As you can see, we do kissing balloon, final kissing, and then this is the final result. And this looks now okay. So this area is okay, this area is okay, LED looks pretty alright, little bit of disruption here, but generally a good result considering this young man. So this is the result of the LED, and this looks pretty okay compared to what it was before. So he had a vasovagal, so once we taken it out, we checked again, made sure that everything is okay, and the patient's fine now. So this is total revascularization using a Twinpass, special wires, and opening up someone, and this area is all viable, and the MPS showed a large area of ischemia in the LED.